Today I am going to talk about CAD-CAM inlays. CAD-CAM is computer-aided designing and computer-aided milling or manufacturing. If the decay is minimal, then we can proceed for direct fillings like amalgam, which is silver-based, or tooth color materials like composites. But if the patients do not report on time or if they delay their treatments, then the cavity becomes more wider. These direct fillings tend to fracture or might get dislodged because of the poor retention of the cavity. Then we have to proceed for inlays or onlays. These inlays can be made up of different materials. One is complete metal, gold, nickel, chrome, and it can be of ceramic or it can be of indirect composites. These ceramic materials can be of lithium disilicate or zirconia, but because of the high aesthetic nature, lithium disilicate is more preferred. It can be of laboratory based or CAD-CAM based. Once the cavity preparation is done, then we take impression with alginate or rubber base impression. We send it to the lab. They fabricate the process and they send it back to us. Then we cement it onto the tooth. But this process may take 2 to 3 days for the entire procedure to be completed. It is more cumbersome because of the lab-based technique. The next one is the CAD-CAM based. Then once the cavity preparation is done, we take a digital impression or maybe a regular impression. And this image is fed into the software. It is fabricated in the milling machine. Then the process is cemented onto the tooth. This process takes 2 to 3 hours. So this is more faster. It can be done in a single visit. We have been doing this inlays since a very long time. But because of the cumbersome nature of lab-based inlays, this CAD-CAM materials are preferred because it is more accurate, it is precise, we get good contacts. Because of the high aesthetic nature, nobody can even recognize the material. It blends with the tooth. It has got high standardization, and since it is made up of a single block of material, it has got less porosities so that any kind of leakage or anything can be avoided in near future. It is more faster. It can be done in a single visit, especially if the patients do not have time. Because of these digital advancement, we are proceeding more for CAD-CAM inlays rather than these laboratory based, and even patients are opting for it. The clinical experience and expertise of the CAD-CAM designing and milling is required so that best outcome for the patient is achieved. Definitely, it is a game changer in the digital restorations.